It's a real pleasure and honor for me to be here. I'm actually a close personal friend of Dr. Reardon's and have been for at least 15 years, and have watched him evolve from one set of technologies to another, and it's the most fascinating journey, just following him around to see what he's doing next. But my journey actually began as a surgeon. I was a general vascular cancer and trauma surgeon from 1971 to about 2003. And during that time, I spent a lot of effort wanting to help fix people's broken bodies, broken organs, replacing things. But I was always considered myself a doctor before being a surgeon. I did a medical internship. Was always fascinated about cell biology and biochemistry, and even in medical school, actually the thing I did best in was biochemistry, probably out of fear, a little bit out of love, but mostly fear, I think. But I realized there had to be other answers and other solutions to how to solve problems. And about 5 years ago, actually 6 years ago, Dr. Reardon was at my house, and we were talking about something near and dear to my heart, which are children with autism. And we got to talking about the pathophysiologic mechanisms, the systems biology approach that tends to connect the gut and the gut problems with the brain problems. And he said, well, let me think about it for a few minutes. And he started putting some notes together, and we came out with a paper, Stem Cell Therapy for Autism. And this is often the case. The guy in the first one actually, I think, wrote it. The guy in the end did all the work, and my name was sort of in the middle for just being part of the think team, I guess. But that really got my brain thinking about stem cells and how exciting it would be to come up with a different approach that could really heal. And I fully believe that this is going to change the face of medicine forever. When we sort out all the politics and economics and political egotism and fighting that goes on in this country, we are going to find out that our $2 trillion, however many $1 trillion health bill will be radically reduced just by using parts of our own body, and particularly the stem cells, over and over. So and this is actually geared for the general public. So, and we do have some people here who know way more than this than I do, including Dr. Maharaj in the back, who already has got me changing one of my slides. I'll tell you when I get to it. But basic concepts, we need to understand the natural process of how the body uses tissue stem cells as well as bone marrow stem cells. And then when we really understand that, we can either do things to facilitate or inhibit this natural process. So that's a lot of what I'm going to talk about. And we'll also talk about how science helps us manage the disease of aging with both autologous stem cells, those are the ones from your own body, and yes, allogenic stem cells that come from other people's body. That's been a hard one for this country to buy into. And there are some reasons, but we have a lot of data worldwide to suggest that the use of allogenic stem cells is safe if used in the right way. So Stem Cells 101, most of you may know this, but adult stem cells are throughout the body. There's no tissue that doesn't have some type of adult stem cells. Another definition, all stem cells that aren't embryonic are probably a form of adult stem cell. The whole issue with the embryonic stem cells, they're totally potent. They're derived from the inner cell mass of the blastocyst, an early stage embryo. And human embryos reach this blastocyst stage after about 4 to 5 days, and it's a little ball like that and of 150 cells. And the cells that are in that wall are the they're the embryonic stem cells. Up here I said very useful for adult stem cells. That's our belief. That's what we use. For embryonic stem cells, useful or not, I'm sure they will find some uses for them, but the fact is the very hunt for embryonic stem cells is probably what put this country 10 years behind the world, because of all the psycho-emotional and religious things that were attached to that. We've now shown you can actually take skin stem cells, revert them all the way back to an embryonic or totally potent cell, so there's no more worrying about embryos being taken illegally and sold for this work. So, but what we're talking about here, all of us will be adult stem cells. This is just a very simple little illustration of how it works. These up here are stem cells. So when a stem cell divides, it can make two just like itself. But then it can even go further. It can divide and make one like itself, and then make what's called a progenitor cell that's going to be a tissue cell, whether it's a liver cell, a brain cell, a kidney cell, or a muscle cell. That progenitor cell then can divide, and from there you get the what's called terminal differentiated, or the cells that make up our body. So stem cells have this incredible ability to reproduce themselves and then reproduce themselves, and at the same time reproduce another one that will be something else. So I'm going to go through this pretty quick. This is just very basic, but I've got the red for the fact that the CD34 hematopoietic stem cells, there's lots of hematopoietic stem cells. The ones with the CD34 markers are the ones we worked a lot with. They come from the bone marrow. The mesenchymal stem cells also come from the bone marrow, but we've now found that there's a huge source of them in fat, and around the world now there's liposuction occurring where they separate out the fat, and what's left behind is called the stromal vascular fraction, which has the mesenchymal stem cell, T regulatory lymphocytes, and endothelial precursor cells. So our body is just full of different kinds of stem cells. So the CD34 make all the blood cells. This is a nice little diagram that basically is a blow up of the bone marrow. And as you can see, the hematopoietic cells, the ones that make blood cells, come out of the bone marrow, go into the blood, and if they go this way, they can make red cells, platelets, all the white cells ranging from macrophages, eosinophils, basophils, all the lymphocytes that have to do with the immune system. Well, the supporting cell to that, called stromal cells, are also another name for mesenchymal stem cell, and the stroma is like the spider web that's actually holding the hematopoietic stem cells. So we use all these cells. These tend to make, originally they thought it was just bone and cartilage, but now we know they make all body tissues basically. So these CD34s help repair tissue, even though these are called blood stem cells that we think of making red cells and white cells and platelets and whatnot. They also repair the heart after a heart attack. People that have got severe chest pain can get these stem cells and have their heart muscle and their vascular lining of their arteries regenerate. Peripheral artery disease, saving people's legs all over the place now using these kind of stem cells there. Liver failure, that's just a few. There's a whole lot of things you can use them for. I've focused a little more here on the mesenchymal stem cell because we use that for a lot of different things, but like I said before, it's also called a multipotent stromal cell. This is actually a mesenchymal stem cell sitting in the marrow, just stuck between the other tissues. And they can actually, they have a lot of non-hematopoietic, which means they don't make blood, but they support the production of blood. They accelerate the repair of everything. And interestingly, there are clinical trials by a company named Osiris. You might look that one up. They're actually using allogenic mesenchymal stem cells, which means stem cells from an unrelated donor, in people that have different kind of illnesses ranging from Crohn's disease to graft versus host disease, and are getting some pretty good results from that. So this is a very simple picture showing how we get, although this isn't a great picture because nobody wants their femur stuck with a needle to get the bone marrow. The main place we get it is out of the iliac crest, which are right along your sides. They numb that up and can put a needle in there and can aspirate it from there. Then you get both from there. You'll get both mesenchymal and CD34. Let me back up that just a second. I would be remiss if I didn't add it, and again, this is due to Dr. Maharaj. He has a technique, and it's well known around the world. You can give stimulating agents intravenously that cause your bone marrow to release stem cells, so that the stem cell population in your bone marrow will go up. And then they can separate those out to concentrate them, or just let them flow through your body and be helpful. I am going to be talking here shortly, though, about the natural ways to elevate your own bone marrow cells. This is actually an umbilical cord and part of the placenta. There's the cord. There's the placenta, and it's extremely rich in CD34 and mesenchymal stem cells. So is the placental matrix. I find this actually hysterical. I just have to say I think it's a great cosmic comedy that everything from menstrual blood to umbilical cord blood to all the afterbirth, things that we typically go ooh and flush down the drain, are the total source of regenerative life for human beings. So this is just a picture of a placenta, and we get all kinds of cells out of there too. This is the latest thing that's happening out there. I already mentioned it. Mesenchymal stem cells are found in adipose tissue. This is obviously just one side. You can also get them from the belly. But we've had a lot of experience with many different illnesses that Dr. Reardon will tell you about, of taking these stem cells out, separating them from the fat, and giving them what's called the vascular stromal fraction, VSF, because it isn't just the mesenchymals. Again, it's T regulatory lymphocytes that really do a lot of immune balancing in endothelial precursor cells. So this is just sort of the bottom line. The source is bone marrow, cord blood, placental matrix, adipose, and this is what you get from each of those. And of course, just stimulated blood, you get them all just in your peripheral blood that way too, by using things like GCSF. So I really do think it's time to rewrite the medical textbooks. It's just fascinating. I mean, there's a whole new way of looking at medicine, both in health and disease, from a stem cell approach. I'm going to say stem cells are in most all tissues. Does anybody know a tissue that they're not in? You know, feel free to answer. I don't know. So we always learn to never say never and never say always in medicine, so I'm qualifying that a little bit. The marrow releases stem cells more or less continually to support areas of need. The younger and healthier you are, the more healthy stem cells can be released into the blood. And the stem cells go, or home to, that term's used a lot, homing, they go to areas of inflammation or injury via cytokine, chemokine, protein signaling messengers. So cells actually release protein messengers, and it can be as simple as interleukin-6 or some of the chemokines have really long names, but these messages basically get in the blood and go throughout the body and liberate and mobilize stem cells predominantly, as far as we know, from the bone marrow. I'm still questioning whether some of the ones found in fat may be liberatable or not. So anyway, this is the important part. Stem cells can become a new cell. They can release cell support or growth factors, or revive local stem cells, wake them up that have been kind of put to sleep for one reason or the other, or do all the above. So these are the problems that cause us to not release our stem cells normally, and it's a very small list. I'm sure there's a whole lot of other things. Just aging alone, you don't tend to. Matter of fact, we now believe that aging is inability to maintain healthy stem cells and the inability to release them from the bone marrow. That could be the new definition of aging, I think. Dehydration, I gotta always say that because people run around with too much alcohol and coffee in their body and stay chronically dehydrated. It's got to affect the hydration of your stem cells, which will affect their performance and their ability to be released. Poor diet, a lack of exercise, sunshine, sleep, poor elimination, smoking, excess stress, toxic exposures to chemicals, microbials, thyroid dysfunction, all of these things is the short list for what can keep your stem cells from being released. Now, I just came across this one last night because all you got to do is stop and think, what could mess up this process? Well, people walk around the world, millions of people with hypothyroidism for lots of reasons. One of the common things is tied back into stress. If you're chronically stressed, you have too much cortisol. Cortisol gets in the cells of your body. It blocks T4 from going to T3. T3 is the active thyroid hormone that goes to the nucleus of your cell and tells the cell to make mitochondria so that you have more ATP and more energy. So I didn't have to look far at all to find a slide that supports thyroid dysfunction as another reason we don't release our stem cells normally. So all the above may decrease stem cell function and stem cell release from the marrow, leading to disease. And the best anti-aging strategy is healthy blood, healthy bone marrow. And you know what? The ancient Chinese sort of knew this. Even in the ancient art of Tai Chi, they have what's called a bone marrow exercise, where they actually have you breathe in and visualize the air coming in, compressing, pushing into your bone marrow, and exhaling, having it go out. Now, whether it actually does that or not, I don't know, but who knows energetically what's going on, and we're going to learn more and more about, and I didn't get into this in this talk, but the whole energetics of magnetic fields, energy fields, and one thing and the other that are like that may contribute to stem cell function and stem cell release. So here's one that's pretty simple. Smoking cessation rapidly increased circulating progenitor stem cells, peripheral blood of chronic smokers. I try to always have a journal reference because I speak journalese. One of my hats is I'm the medical advisor for the University of Miami's Integrated Medical Department, so when I'm talking to my surgical or medical colleagues, they want that, but they want this too, and then they get upset because they don't know about it. But the medical literature now is so full of data supporting what we're doing, it's really interesting. Lung disease. And a lot of this occurs with aging because of constriction of the rib cage and hypoventilation. People aren't breathing enough. But look at that. The endothelial cell colonies and hematopoietic progenitor-derived stem cells were reduced up to 50%, and that was proportional to their degree of disease. So here's the one about thyroid hormones are required for normal B cell production in the bone marrow through regulation of pro-B cell proliferator and establish a role for the pituitary thyroid axis in B cell development. So just think about it. If your thyroid doesn't work, that's one of the reasons your immune system doesn't work right, and probably a whole lot of other things. I don't have a slide for it, but I'm always looking. Sitting here, I said, well, I bet you we can throw alcohol in the pile, and sure enough, alcohol also suppresses stem cell release and function to some degree. I'm not saying maybe an occasional drink, but certainly the more you drink and the more unable you are to process it appropriately, the more it's going to affect both your stem cells and the release of your stem cells. So these are some ways to increase your stem cells. Exercise has been shown, all kinds of exercise help considerably. You can actually measure people's white blood count and their blood go up after exercise. If you pull that blood out and separate out the white cells, you'll see they have more circulating stem cells in. And maybe that's the magic connection between having a really good health. Most people, if they don't over-exercise, are very healthy. The flip side is, like everything's a question of balance. I've seen some people that over-exercise and ended up with things like chronic myelogenous leukemia due to immune suppression. Sleep is critical. I'll get into that on another slide. Hyperbaric oxygen clearly releases stem cells, and one of our guests here, Ray Crowley from the back up in Delray Beach, actually has these devices in his office and has seen some wonderful things with hyperbaric oxygen. And I'm sure one of its great features is literally the releasing of stem cells. Nutritional supplements do it. Things like green tea, astragalus, goji berry extract, blueberries definitely do, carnosine does, good bacteria do, all antioxidants. Vitamin D3, actually Dr. Reardon did a little study in Panama that showed if you didn't get people's vitamin D3 had to be like 40 nanograms per milliliter to get the elevation of the stem cells in the peripheral blood. And most people walk around with vitamin D levels in the 20 or low 30 range, or even in the 10 to 15 range. If you didn't get anything else out of this, get your vitamin D level checked. Don't be surprised if it's under 30. If it is, just take D3 anywhere from 3 to 5,000 units a day and check it every 3 months until you get your level at least 40 to 60. And isn't it interesting that all of these things that increase stem cells are things that increase good health? And Dr. Reardon actually put a product together called StemKine that's been shown to release a particular type of the endothelial precursor cells into the blood. So here's an article to support the exercise. Short, intense exercise increases migratory activity of mesenchymal stem cells. We do know that circulating, contracting skeletal muscles make and release interleukin-6 into the systemic circulation, and as that level spikes up, that spike in IL-6 will stimulate the migration of mesenchymal stem cells. So there's definitely a relation there. That's just one paper, and it stimulates all stem cells, not just mesenchymal, but I thought it was interesting to find a paper that supported that. And it's very interesting because skeletal muscle will increase IL-6 like 100,000 times in the blood with exercise, but it quickly comes back down. But one of the other things that does, Our fat is always releasing IL-6, interleukin-1 beta, TNF-alpha. Fat is inflammatory. Fat alone will raise your stem cells in your blood. And I think that the purpose of that is trying to put out the fire, but obviously it doesn't necessarily do it as long as the fat's doing it. But the exercise, when it spikes at IL-6, it actually shuts down the fat production of IL-6, IL-1 beta, TNF-alpha, TNF-alpha receptor, IL-1 beta receptor. It shuts all that down for 12 to 20 hours. So that's the anti-inflammatory effect you get from a moderate amount of reasonable exercise. And that's why out of all the arguments, nobody will argue against exercise. Back to the sleep thing, circadian rhythm is critical. They've shown that hematopoietic stem cells circulate in the bloodstream under steady state conditions. It's almost like the body likes to have a rhythm it can follow. It keeps its organization better. So circadian neurally driven release of hematopoietic stem cells during the rest period may promote the regeneration of the stem cell niche and possibly other tissues. That was from Nature. So here is the bottom line. Don't shoot the messenger. Bottom line, minimum 7 to 8 hours of sleep. Go to bed by 10 to 11, same time every night. That's how you establish a circadian rhythm. Now, if you happen to work at night, you just make your circadian rhythm. But it really makes sense to try to go to bed at the same time, ideally 2 hours before midnight, because the way the hormones release, particularly growth hormone, I think you can shortchange yourself if you are chronically going to bed 12, 1, or 2. Some people might argue that their circadian rhythm shifted, and I guess if you sleep enough and do it regularly, the big thing about it, though, is sleep in the dark. Most people aren't aware you need to be pitch black in the dark. They've done the study where they had IVs in people measuring their serum melatonin levels. They're sound asleep, covered up, uncovered their leg, flashed a light on their leg, and as they held the light on their leg, their melatonin levels dropped. It's like your body is literally built to wake up during daylight because, I guess to protect yourself from whatever else might be out there. This is a fascinating book that I recommend by a guy named Bent Formby. He's a PhD in biochemistry and molecular biology. It's called Lights Out, but this is the bottom line of the whole book. The sugar never stops and the lights really don't go out. So cutting back the sugar and the light will actually help your health and certainly help your stem cells. Here's a little article about HBO causing rapid stem cell mobilization in both humans and mice and its nitric oxide dependent mechanism. A lot of exercise is nitric oxide dependent, so a lot of overlap here, again from the Journal of Physiology. So here's the new progress in mesenchymal stem cells, and as I write this, there's new progress. I'm sure as people in the audience know more about it than I do already. They don't require external differentiation. I found a lot of articles where they take them and they bathe them in this and that, and they make them turn into a mesenchymal stem cell. They don't require differentiation, but they can change into a cardiomyocyte, hepatocyte, added to the body. When they're in the body and go to a tissue, they can differentiate into what they need to be. Probably the other stem cells as well. But the mesenchymals also produce growth factors and secrete them in the bloodstream, acting at a distance. Even more interesting, mesenchymal juice, or growth factors produced in vitro, can be injected IM or IV and go to where they're needed. And Dr. Reardon just told me the latest. Some of this juice injected into animals can convert their monocyte blood cells into mesenchymal stem cells in the blood. I actually personally tried this. I had an arrhythmia. Last September I was down in Costa Rica for a stem cell conference. I got an injection of the mesenchymal juice and my arrhythmia went completely away for 9 months. It's just starting back, so I'm looking forward to some more juice. What to do before and after receiving stem cells. I'm a big believer to eat organic whenever possible. 80% plant-based. Animal products are fine, but they need to be organic, free range, clean as possible. I already talked about the sleep. I already talked about the exercise. I do believe it's a good idea to take a multiple vitamin, vitamin D3, fish oil, and probiotics most every day. Consider toxic metal challenge and detoxification program. Honestly, I didn't even want to look at that. I will look at it, but I suspect that if you have a heavy body burden of lead and mercury, which you won't know if you don't do a challenge test, those will severely affect stem cells in the bone marrow and stem cells in your tissue. They affect every other cell. Why wouldn't they affect that? It's a big problem we have because of our toxic planet, but you can go to acam.org and find a physician that provides you with either capsules or a small injection to find out how much lead, mercury, cadmium, arsenic, aluminum you've got in your body, and if you've got high levels, you need to work on lowering them. I actually found out that was the cause of my arrhythmia because I did 2 stress tests, a CT angio, an echocardiogram, passed everything with flying colors, checked my mercury, the level was high. So before I got the stem cells, I could actually take the chelating agent and watch my arrhythmia go away as my mercury levels drop. And I will continue to do that because I happen to have certain genes that make it a little difficult for me to eliminate it as easily as maybe other people do. So modify lifestyle, and I mentioned lowering the stress. The interesting thing about the adrenal gland is if you're overstressed and it's really pumping out cortisol, like I said, it blocks T4 from going to T3, so you won't have enough thyroid hormone. Guess what? If your adrenals are worn out and exhausted, if your cortisol is too low, same thing. It blocks T4 from going to T3, so you don't make enough mitochondria. So this is the paper, and I'm almost done, just present one case. But this was just a paper where they actually showed that they could use the MSCs, allogenic from a donor, and they also use mesenchymal stem cell chondrocytes, suppress the responses of type 2 collagen reactive T cells in rheumatoid arthritis. This is from Rheumatology 4 years ago. So here, the case I'm going to present is just one of the more amazing ones I personally know something about. The use of autologous MSCs, case of rheumatoid arthritis. Kathy's a 67-year-old, I'll just read it, and you can read it with me, with rheumatoid arthritis and a rheumatoid factor of 76. If you notice, it should be less than 13. Or anticyclic citrulated peptide antibody, which is a more specific marker for rheumatoid arthritis. Hers was greater than 250. It's supposed to be less than 25. So the symptoms, this was back in 2008, progressively worsening fatigue, excess sleeping, redness of both hands, pain and swelling both ankles and knees, severe pain and swelling in her fingers, stiffness in her hands and wrists, especially in the AM, also feeling as if she had the flu with increasing pain and difficulty walking even short distances. So I love this. She was seen in Mayo Clinic by a rheumatologist April 2008. He said, "You've got bad rheumatoid arthritis." Those were his blood studies you saw on the other page. He says, "Your only hope is to get on prednisone, and then we'll get you on methotrexate." And she said, "Well, I really don't want to do that." So she said, "No, thank you." Went home, and for the next 4 months, it's lucky she didn't eat out her stomach because she lived on ibuprofen and Aleve. That was in April. So in August of 2008, she went to our stem cell clinic 4 months after the Mayo visit. She got a micro liposuction, and it is micro. It's not the kind where you use like a vacuum cleaner and suck all the fat out. They use a syringe and just gently tease out the fat they need. And I got to just stop for 1 second. I meant to say it earlier. I actually used to do liposuctions about 15, 20 years ago with a friend of mine, and I can remember sitting there looking at those buckets of fat, telling him, I said, "There's got to be something in there someday we're going to use that's got to be of great value, and we're going to be able to sell it." Now, how's that for being prophetic and not knowing it? But anyway, so they do this mini liposuction, and we have cell counters, so we actually know how many cells we get. So they got about 50-some million cells. Well, day one, she got 26 million IV. She said that night, I don't have it on here, but that night, she says the first night she'd slept all night in ages. Second day, she got 27 million, or a total of 53 million. She said she felt considerably better after the first, completely better after the second, and began walking normally by the third day. She and her husband walked all over the coffee plantation and went up into the higher country there and walked through the forest and whatnot. And so I've done a couple of phone interviews with her. I actually interviewed her November of 2009, and her labs were almost normal at that time, but her vitamin D level was only 20. She had never heard of it. Her doctors never heard of it. So I put her on 5,000 and told her to take it most days and to keep a check on it. She's got her level up where it needs to be now, up over 40. And I've often wondered when we see that, if how much of the low vitamin D is actually a major trigger to so much of the autoimmune, and particularly Crohn's disease, ulcerative colitis, multiple sclerosis, and all of the other immune diseases are probably related to chronically low vitamin D level, which we can get if we would get in the sun, but that's another lecture, and there's a lot to know about that. So at that time, she said she had started with a personal trainer, works 3 to 4 times a week, feels better than she did 25 years ago, and I had a consult with her yesterday on the phone. She said the stem cells, I said, can I quote you on that? She said, yes, stem cells have helped her more than anything she has ever done. She continues to work out with her trainer and has gone from barely able to climb the stairs, and the lady, she'll shoot me for telling you, 70 years old, is now doing leg presses with 370 pounds with a trainer. I'm sure that's with a machine, but still, that's pretty remarkable. So thank you very much for your attention, and I think it's time for somebody else to talk.